nice to see so many of you joining us for this important conversation. And thanking again our panelists, President Riley. Dr. Martin Luther King Jr. understood that health and justice was not separate from the civil rights struggle. In fact, it was central to it. It was on March 25th, 1966 in Chicago at a press conference before his speech at the second convention of the Medical Committee for Human Rights, where Dr. King said, "We're concerned about the constant use of federal funds to support the most notorious expression of segregation, of all forms of inequality. Injustice in health is the most shocking and the most inhuman because it often results in physical death." In this remark, Dr. King was naming a fundamental truth, that health reflects every system we build or fail to build, whether it be housing, education, labor, employment, environment, and public policy. And because this quote is sometimes misspoken, I want to highlight a few key points. First, Dr. King spoke of injustice in health, not in healthcare. For Dr. King, his unfailing attention to poverty, racism, education, and housing, what we often now call the social determinants of health, makes it clear that his moral concern goes beyond healthcare alone. Second, Dr. King said that injustice in health is inhuman, not inhumane. Inhumane refers to a lack of compassion of human suffering or pain. Inhuman is even more extreme, implying a loss of humanity itself due to the egregious cruelty of these acts. And as a social epidemiologist, my work is grounded in this truth. Public health research and our own lived experiences confirm what Dr. King recognized long before the data existed, that health inequities are structured, they're predictable, and most importantly, they're preventable. The patterns we see in chronic disease outcomes, life expectancy, and premature mortality are not random. They are downstream consequences of systemic decisions and disinvestments that are made over time. For more than 20 years, my research has focused on these structural and social drivers of health, particularly how chronic disease inequities emerge and persist in urban, racial, and ethnic minoritized and disinvested communities. Too often, these inequities are framed as individual problems. They're seen as more about behavior, lifestyle, and yes, even genetics, but we know that the evidence tells a very different story. Health disparities are shaped by systems. They're patterned by where we live, whether our neighborhoods are safe, whether healthy food is accessible, whether people are paid a living wage, whether schools are adequately resourced, and whether healthcare institutions meet communities with dignity, trust, and the highest quality of care. So when we see disproportionate rates of diabetes, hypertension, asthma, cancer, or other preventable conditions, we are not witnessing personal failure. We're witnessing the cumulative impacts of public policy choices and institutional practices that have explicitly placed communities of color at greater risk. That is why Dr. King's words remain so relevant now. He did not view injustice as inevitable. He understood it as the result of systems that could, should, and needed to be changed. Institutions like ours here at Downstate play a critical role in that change. We're not neutral actors in the production of health. Our policies, our priorities, and our partnerships can either reinforce inequities through inaction or interrupt them through intentional community-driven strategies. Research alone does not reduce disparities. I'm going to say that again for all of the faculty, scientists in the room. Research alone does not reduce disparities. Research alone does not reduce disparities. Y'all hear me? Okay. Evidence must be translated into action, and action must be guided by accountability and transparency. In my work, I focus on translating my research into multi-level interventions that seek to address structural barriers by centering communities. That translation from data to evidence-based practice is itself a form of service, and it is one way that Downstate honors our public mission. This is especially true for academic medical centers and public serving institutions like ours. Our very position comes with the responsibility of not just treating illness, but examining how our institutional decisions shape the conditions that produce health long before people ever walk through our doors. That's the foundation for today's conversation. We'll examine how power and policy shape key health outcomes, how trust and bias influence care, and how civil rights leadership rooted in Dr. King's legacy calls on institutions to move beyond intention to measurable action. Health equity is a civil rights obligation. It is something that we can assess, that we can address, that we can advance if institutions are willing to take responsibility for doing so. Dr. King believed that justice required action and that if inequity can be designed, then it can be dismantled. The question before us today is whether we as institutions and leaders are prepared to do that work. I hope so. In that spirit, then, it is fitting that this conversation is moderated by a leader whose career reflects that charge. And so please join me in welcoming Dr. Wayne J. Riley, president of SUNY Downstate Health Sciences University. Dr. Riley, I'm going to keep it brief, brings more than 30 years of experience as a physician, public servant, and academic medical leader. Since assuming the presidency in 2017, he has led Downstate through renewed stability and a historic $1.1 billion state investment to modernize and preserve Brooklyn's essential public safety net hospital and only academic health sciences campus in Brooklyn. Throughout his career, Dr. Riley has centered the responsibility of institutions to serve the public good, embodying Dr. King's insistence that justice must be expressed through leadership, policy, and sustained institutional action. Dr. Riley.
Thank you. Well, good afternoon. Thank you for coming. And this is very important for the community, very important for me personally, that we pause every January to remember Dr. King. We don't necessarily do it on the federal holiday, but we always do it at some point in January, which we think is quite appropriate. You know, over the years, I've had the honor of giving MLK talks all over the country. And one of the ones that I sometimes use when I travel the country during the month of January, it's an MLK talk, and it starts with a question. What would Martin think? Now, if you talk to anybody who's participated in the civil rights movement, I personally know Reverend Young, Andrew Young, Martin Luther King's right-hand man. He's from New Orleans. My late father took care of his father, Andrew Jackson Young Sr., a dentist in New Orleans. But when you talk with Reverend Young, he said back in the 60s, you know, everybody was, when Dr. King was alive, and they're, you know, trying to figure out what to do, what strategy, you know, whether we should march here, picket there, you know, boycott here. You know, the ministers and the organizers would often turn to each other and say, what would Martin think, right? And what Martin Luther King would think about the current state of health equity and health disparities is, quite frankly, he'd be aghast. He'd be aghast at some of the health inequity that exists in this country in 2026. And Dr. King wouldn't sugarcoat it. And towards the end of his life, he was letting it rip, right? He was letting it rip. That's why he went to Memphis. You know, to help out sanitation workers who weren't being paid a living wage in Memphis, Tennessee, and that's where he fell, where he was murdered. And so he cared deeply about you know, the state of America, the state of the world. And with regard to health, I'm so glad Dr. Rivera Camacho reminds us that quote is often misquoted. You see it all the time. They always say inhuman. No, inhumane. He actually said inhuman, as we just heard. And that's worse than inhumane, as the professor just pointed out. So when you see somebody misquote Dr. King, please correct them gently. He did not say inhumane. He said inhuman. And so that is the spirit in which we have this commemorance, this discussion, this dialogue. Now, on September 20th, 1958, Dr. King was in Harlem at a book signing for one of his books at Blumstein's department store in Harlem. Whereupon, at some point during the book signing, he was sitting at a table much like this. A 42-year-old woman named Isola Curry, a black woman, walked up to him and stabbed him in the chest with a letter opener. And Dr. King was rushed to Harlem Hospital, and the accounts of the surgeons who took care of him was that the letter opener entered just near the sternum and was like this close to the aorta. And so he underwent a complex operation, and he talked about this for the rest of his life, this near-death experience that he had. But at some point during his hospitalization at Harlem Hospital, he was asked, well, Dr. King, you just got stabbed, by this woman, Miss Curry, who's obviously crazed, deranged, et cetera. And they said, well, how do you feel about this? And so this is what Dr. King says. And if there's any Kingian philosophy of healthcare, it's in this quote. Dr. King said, I feel no ill will towards Mrs. Isola Curry and know that thoughtful people will do all in their power to see that she gets the help she apparently needs if she is to become a constructive citizen. Think about that. Would we have the guts and the gumption and the forgiveness to say that after someone beat us up, stabbed us? But that's the Kingian philosophy of healthcare, reduced to something that he endured, almost losing his life. And he used to joke about it for the rest of his life. He said, I came within a millimeter of dying. And he'd sometimes say, if I sneezed, his doctor told Dr. King, good, thank God you didn't cough or sneeze, because that letter opener would have gone right into your aorta. And so he joked about this for the rest of his life, that I was a sneeze away from death. But this is the way he felt about health care. He wanted Mrs. Curry, a paranoid schizophrenic black woman, to get all the care she needs in order to lead a productive life. And so that's why we're here today, this panel, to just talk about these issues. And we're joined by three outstanding leaders. First is Dr. Catherine T. Hall. Dr. Hall is the Senior Vice President for Research at the New York Academy of Medicine, where I chair the board, former Deputy Commissioner of the Boston Department of Public Health, an outstanding researcher at Harvard School of Public Health, and someone who has made a difference in terms of her body of work. And Professor, she knows it ain't just about the research. Catherine's done the application. So you're going to hear about that also. This next fine gentleman is an outstanding professor and academic in his own right. I was just teasing him. I said, I see you on MSNBC and CNN and all those shows, and I'm always like, yes, Professor nailed it. So, and that's Professor Basil Smikle, who is outstanding thought leader in anything in terms of our nation, understanding where our nation is and where our nation was. So we're delighted to have both these fine speakers, and the next speaker, we hope she gets here, probably got caught in traffic, is Ms. Arbor Rice, who is the presidency of the New York Urban League. So when Ms. Rice comes in, we'll easily inculcate her into the conversation. So as I take my seat, I'll ask Dr. Hall to introduce herself, and then Dr. Smikle, and then we'll proceed with questions.
Thank you, Dr. Riley. It's a absolute pleasure to be here today, and I'm really excited to talk a little bit about placebo effects and nocebo effects and what the heck they could have to do with our current times.
Good afternoon, everybody. Basil Smikle. I'm also pleased to be here. Apparently, there are a lot of Jamaicans in the room, too, so thank you for saying that.
Let's hear the Jamaicans.
All right. We'll talk afterwards. And I'm, glad to be here, particularly with my friend Arvo, who will be here shortly, to again talk about how a lot of these issues are not new. They're actually quite old, and how we can think about them today and hopefully offer some steps forward.
Great. Thank you. All right, let's jump into the questions. First question. you know, healthcare is a civil rights issue. Sometimes when I mention this in my talks, people kind of look at me like I'm half crazy. How is healthcare a civil rights issue? But again, if you recall what I just said, that how Dr. King felt about this, excuse me, you can see that he understood that implicitly. And while, you know, marching for voting rights and housing rights and all the other key critical pieces of the civil rights movement were front and center, I don't think healthcare was that far from his mind at all. So to both of our esteemed panelists, what is your view about the whole issue of health equity as a civil right? Dr. Hall, I'll start with you.
You know, I think life is a civil right, and a healthy, and it's a very fun. From the moment you're born, we're exposed to all the potential factors that can cause us harm, and I think that it's not just a civil right. It's also, I think, incumbent on our families, our friends, our communities, our government, to help us, to protect us, to help us to grow healthily. And I think it's a right, and it's a duty, and it's a privilege.
Absolutely. And I want to pivot from your comments about Dr. King. I often speak around this time about his legacy. And one of the things I like to do as a PhD myself is go look at his dissertation. Mm-hmm. And he, long story, and I won't get into it about what he's actually written, but he's wrestling with different concepts of man's relationship to God. And in that, he kind of draws the importance of the social justice gospel, right? And having a sort of personal relationship with God, but that should not preclude you from having interactions with each other and finding strength in that. And when I look at the historic, the ways in which, if we go back in history, our country, as at the highest levels, created these disparities intentionally. It's no wonder that he would fight in the ways that he did. And I always say, you know, he got killed when it wasn't just a black thing, right? That he didn't just talk about the role of African Americans in this country and their rights, but talked about Vietnam and talked about and organized labor.
He was letting it rip.
He was. And so when you look back at when you look at what's happening now, could we talk a little bit? No. I'll just touch on it. When you look at what's happening now, it's important to realize that this is not new, and that there are so many ways in which our country has weaponized different parts of this government to pull us apart, and that we're spending so much time trying to pull things back together. It's no wonder that there are these real conversations about what's the point in fixing something that is inherently broken. And so these are real conversations that are happening that we're all still trying to wrestle with. But that historic disparity is as old as this nation itself.
Thank you, Professor. Let's stick with the now. I won't be political, but I will. You know, I have conversations all over the country with physicians and people who have my kind of job here at Downstate. Hey, Arva, welcome. Let's give Ms. Rice a hand. Take a deep breath. You made it. I know it was horrible out there getting here. It was horrible, Arva. Thank you so much.
I walk from Harlem, y'all.
Oh, my gosh. How many steps is that? You got your step counter on? What say you, this distinguished panel, about what's called the political determinants of health? That politics in our country has a great deal of bearing on health policy. So speak to us about the political determinants of health. In a few weeks, this is a sort of a plug here, we're going to have Professor Daniel Dawes, who wrote the book, The Political Determinants of Health. He's going to be here in a few weeks. And he's written a fabulous book on how politics really does determine health policy to some degree. So let me turn over to the panel. Arva, you want to take a little breath, or you want me to go to others first, or you want to jump in?
I'm going to let you go to others first. I think I missed my favorite question. Did you already ask about civil rights?
Yes, but we'll come back. Well, we can come back to that. We're going to come back. I know that's right up your alley. We're going to come back.
That was my favorite question.
Yes, but Dr. Hall, what say you about the political determinants of health?
Well, there's no question that, what we are exposed to in our environment, whether they're words, images, affect us physically. And I would say that I would even go beyond the politics. I would say that we're in an unprecedented time where our brains are assaulted with image after image, information bite after information bite that usually we would kind of process together with our families, our friends, at cocktails parties, at the gym, for a week. But within hours, there's another bite. And what that's doing to us is it's exhausting our brains, and I think allowing the temperature to go up. And the temperature is going up, and where we're going with this, I think, is probably what we'll touch on later. But I would say that it's almost beyond politics to me, what's happening. Politics is the vehicle, but it's only the tip of the iceberg.
First of all, it's okay to be political. What we may run into problems is being partisan, because what I always say, being black is political, right? It's exhausting too, but it's political. It is about the choices that we're confronted with versus the choices that we have to make, and always thinking about this concept of sort of shared fate, that what happens to one happens to all. And so I think just having to navigate this world, given that there's so many choices, as the questions as you raise, there are so many choices coming from the highest levels of government about our lives. We have no choice but to be political, right? And so I think about one of the first things I ever did in my career when I was working for the then borough president of the Bronx, Freddie Ferrer. This goes back a ways. Was represent him at a press conference to call for the closing of a bus depot in Harlem, right? Because there were so many, if not almost all of them, were in Upper Manhattan at the time, of course, with the highest rates of asthma and so on, right? And so when you think about that, you're like, well, yeah, this is their go-to, right? They'll just put things in our community and not be mindful of, or are mindful but don't care about the effects of these things, right? I show my students. I grew up in the Bronx. Anybody from the Bronx originally? Yeah. Thank you. I know that comes a certain way. I know where I am. Trust me. I know I'm in Brooklyn, but I will call out the Bronx anytime I can. She did. God bless her. Are you Jamaican too? That's why. That's why. That said, I grew up there in the 70s and 80s, and I remember when, buildings were burning and the fire department never got there, right? So they would just let things happen because they just didn't care. So when you think about the decisions that are made that impact our community, they're being made every day, all day. But one of the things that that I think has, we really have talked about a bit, but not nearly as much, are the impacts of taking certain jobs and majors out of, quote, professional careers, right? And what that's done. The fact that it has become a lot more difficult to get a certain type of student loan right now. So at the university level, we're seeing a lot of changes in who goes into certain careers because it is now prohibitive for them to do so. So there are sort of big decisions and there are small decisions, and that's why, as you go back to the brown lady, I tell people all the time, elections matter. That's right. And the President of the United States, it's true for governors and mayors, but the President of the United States appoints a lot of people into positions of power. And there are these decisions that are being made every day, all day, that we may never hear about until it's too late. And so everything from what is considered a professional degree, how you apply for and who is eligible for student loans, decisions like who gets or does not get SNAP, right? The decisions around Medicare, Medicaid, All of these things are meant to take out of our community instead of doing things to help support it. College didn't get expensive until we started going, and so right, and so this is intentional because it is meant to say, we're done with you all. That's my feeling. I'm sorry, I'm just going to speak. No. We're done with y'all, right? You fend for yourself because you're not going to do it on our dime. Meanwhile, everybody else is doing it on their dime, right?
Well, to your point, none other than the President of the United States openly said 2 weeks ago, the civil rights era went too far.
Yeah, they did say.
But let me stick with the political determinants out, then I'm going to go to Arva. As opposed to you highfalutin New Yorkers, I'm from Nolens. Ms. Rice, your big boss, Mark Mori, I've known since I was a teenager. His grandfather delivered me, C.C. Heidel Sr., delivered me on a Sunday afternoon at 3 p.m., 3.5 weeks early, 4 pounds, 2 ounces. And my mother said, I've been impatient ever since. So, one of the stunning things about when you grow up in the South, as I did, and you look at what's happened in terms of voting patterns, Southerners have an amazing ability to vote against their self-interest, and particularly white Southerners. Who's been the biggest beneficiary of the Affordable Care Act?
Yep.
Who's been the biggest beneficiary of Medicaid expansion? SNAP. It's not black and brown communities in terms of the plurality. Any reaction to that? Then we're going to go to Arva.
Yeah, you go ahead.
Well, there's a thing in politics we call permission structures, right? Which is, so when you're trying to understand why people vote against their own interests, we always go back and say, well, what is their real interest, right? So that permission structure is not about healthcare. It's not about that. It's about hating other people who have it. It's about calling attention. It's about, and Lyndon Johnson said it, I'm not going to butcher the quote, but it was like, if I can make the lowest white man feel that he's better than the black man, he can pick his pockets all day, right? And so that's what's happening. It's making a group of people in this country, generally people who are white and poor and live in red states, feel that their whiteness, this hierarchy, benefits them no matter what, no matter how poor they are. They've made them feel that they're closer to the billionaire than they are to us. But remember, that was a tactic during Reconstruction, right? That divide and conquer, still going on. And so they're not voting. So when we say they're voting against their interests, what is their interest? It's the hierarchy. That's what they're voting for. It's the maintaining of that hierarchy. And so that's how they can vote for someone like this president, but also have their health care taken away, also have, the women in their family threatened with respect to reproductive rights, on and on and on and on. I don't see that changing anytime soon, at least not in this current environment.
And I think that builds on the fundamental way our brains work, right? Is that our basic question is, are you predator or are you prey? Am I going to approach you or am I going to run? Are you a threat or are you not a threat? And I think that, we have systematically seen this taking advantage of by ripping groups into half. Over here, you have the transgender and the straight people. You have the males and the females. You have the immigrants and the Americans. And whatever it takes to make that rip so you can point to the other person, they're the prey, I'm the predator. This is fundamental to how we think and how we behave, and it's shaping how we are approaching life, many of us, because we don't know from one day to the other, are we the predator or the prey? And so we're in this state of constant fight and flight. And it's a terrible situation, and it's just, I really don't see any end in sight until the ultimate.
Yeah, till there's regime change, right? Let's go to Ms. Rice. Thank you, Arva, for being here. Outstanding leader of the New York Urban League. Thank you. Let's give her a round. But we did start Arva before on the whole question about the nexus between health and civil rights. Is health a civil right? The nexus between health and civil rights. So please share your thoughts.
Absolutely.
Thank you so much, and my apologies once again for being late. I hate being late because I need to be here on time. I also hate being late because I really wanted to hear this topic today. And so I wanted to hear it from the beginning all the way through. And then also I wanted to take a point of personal privilege, and I'm going to do that anyway. And that is that I wanted to publicly thank Dr. Riley because we called him at the beginning of COVID. And at the New York Urban League, we were trying to find a way in which to provide value add at that moment. And in that particular moment in time, literally people were saying, well, I don't think Black folks can get COVID because COVID is when you're nasty, when you don't clean up, when you're dirty. So Black folks, they clean their houses. So that means that we probably won't get COVID. Right? And then the next week passes, and if you freeze stuff, then you won't get COVID. And then finally it was just like Hazel Dukes. I remember Hazel Dukes and C. Virginia Field said, the numbers are increasing. Every week they're increasing. We should find out how they're impacting our communities because it might be impacting us more.
Yeah.
And
Case in point, your big boss, Mark Morial, texted me. He's saying, Wayne, tell me what's going on with COVID. And I said, Mark, this is going to be bad for our community. And he called me right away.
Yeah. And so we were trying to figure out something to do. And so we said, we'll start doing these Zoom calls. I didn't know how to set up a Zoom. I didn't know what Zoom was. I didn't know anything about it. But I went to my young professionals, right? So they said, Ms. Rice, we're going to help you figure this out. We're going to set it up. We're going to do the Zoom call. But now we need to call an expert. And at the time, I was very good friends with the CEO. Well, still I'm good friends, the CEO of Harlem Hospital. But she was busy. She was like, she's trying to find stuff and put things together in order to make this happen. And I called you. Yeah. And at the time, I didn't know that you knew Mark Morial. Yeah. And so you took this call from this Black girl you didn't even know, and you said yes.
I know the answer.
And you said yes, and you got on that phone, and we had thousands of people over the course of COVID that got on the calls just to get just basic information. And so I just wanted to publicly thank you for that. It was just such a crazy, scary time, and we have not given ourselves an opportunity to step back from it, right, and say, right, like what are the real long-term impacts of COVID on our communities? And I think that that we need to make sure that we remember it, and that we remember it and are able to use that moment in time in order to have that be a moment that we can look back and say, we got other people to see health inequities, and as a result of that, we're able to put together this certain set of policies. But going back to your question. About looking at health inequities as a civil right. And I think that is very important because when you talk about things as a right, it no longer becomes a request, it's a demand. Right? And so that subtle shift is important. And by looking at it as a civil right, it also suggests that there's a documented inequality that's there. And so that inequality is there. And so it is a problem, and it's a problem that can be solved, and it's a problem that can be focused on. So that's what happens when you look at it as a civil right. When you also talk about it as a civil right, you know that there is a system that has been put in place in order to keep that injustice there, right? So that's the frame that shifts when you think about it as a civil right. There's also a sense of erasure, right? I am embarrassed that I did not know about the Mercy Douglas Hospital in Philadelphia. That should have been part of my regular consciousness, and I just found out about it within the last 5 to 10 years, and the impact, the nurses, the doctors that they trained and supported. But whenever there's an erasure, you know that it should be about a civil right, right? And whenever something moves to civil rights, there are institutions that should be instantly mobilized to come to the table to bring up that issue and to continue to bring up that issue. The Urban League, the NAACP, National Action Network should be coming to the table in order to talk about it. And so that's the reason why I wanted to be here today, to be even better armed for what I know is going to be the fight ahead.
Hear, hear. Thank you. Thank you, Arva.
Can I just one more thing? The doctor said something that triggered a memory that I think is really important because to discuss because of this prey thing. I don't think we realize how much we are being preyed upon. 2 quick stories. Found out a couple of months before the last election, 24. A friend of mine is one of the biggest sort of political mail, not carriers, vendors in the country. And she sent me a note. She said, Baz, I really need to talk to you because you got to bring this you got to talk about this publicly. There was a campaign a couple of years ago to to ban menthol cigarettes.
Oh, yeah.
Right? Right. And I think the NAACP, I don't know if you guys were a part of it, NAACP was a part of it. And come to find out, these other folks were sending mail to black voters in the Midwest saying the Democrats are going to take your cigarettes away. All right? I mean, for months, they were doing that. That's both electoral and health consequences, right? Second point, I call it my paternity court story. I don't have any kids, so I got to rephrase that. But I was getting these clips. I don't have any kids, but I was getting these clips of paternity court on my phone, in my feed. And I'm like, why am I getting paternity court? Clicked on, went to the YouTube video. So it's the full episode. First commercial. So Trump ad. And I'm like, going after black men. I was like, that's serious. And this was a couple of months before the election. So when you think about this divide and conquer, the predator or the prey, we have to put ourselves in a position to consider the fact that we are being preyed upon and don't even realize it constantly throughout the day. And that from a mental health perspective, from a health perspective, it's an extraordinary. We're living in an extraordinary time where we can't even pinpoint the moments where we're being manipulated. And that, when you find out at the other end of it, I mean, that is what's so jarring.
Yeah, that is. That's great. Yep.
Yeah, just to add to that and to add something you said earlier, this is not new. In 1736, Benjamin Franklin's son dies of smallpox. And he was going to have him. It wasn't vaccination back then, it was variolation, which, by the way, was developed from an African man, Juan Simas, but that's another story. But he didn't have him variolated or vaccinated because the boy was not well yet. But people thought it was because he was an anti-vaxxer at first and changed to a pro-vaxxer. So basically, the story went that Benjamin Franklin killed his kids by vaccinated them. So it's that we're all prey. Let's face it, right? It's like the person on the top is the predator and all of us are prey. And we see that when people are shocked that a white man who, worked as a VA nurse is killed. But the bottom line is, this is, we're animals. But coming back to this point that these stories get turned and, we are not really sure what's the truth, and so we don't know who to trust. And without trust, I don't think we can be healthy. Without trust, I don't think we can be safe. I don't think our children can be safe. Without trust, the very fabric of who we are as human beings has been ripped up, eroded, and here we are.
Yeah, great. Let's shift to the role of institutions. Many institutions express a commitment to equity or health equity or addressing health disparities. But sometimes you feel that it's hollow, that it's performative. Any reaction to the role of institutions in health equity?
Well, sometimes.
Or the lack thereof?
Oh, lack thereof. Sometimes I think that depends a lot on generation. Mm-hmm. A lot of younger voters don't trust institutions at all. And we see that, when we try to approach them with respect to, voting and so on. So it's not just political institutions, it's institutions broadly. There's just no trust there. And that is a problem that I don't see an immediate solution to, number one. Number two, when you look at I run the master's program in nonprofit management at Columbia, and one of the things that we deal with quite a lot is the fact that a lot of institutions, a lot of nonprofit organizations are afraid to do the justice work that they set out to do because they feel that they're going to be targeted. Not to mention the fact that there are organizations, one I'm on the board of, that you know our friend well. She helps young people young black and brown kids live in poverty, get into top tier high schools and colleges, and had a concern that because of everything that's happened, a lot of the donors pulled out. A lot of the people she wanted to honor pulled out. That chilling effect is what we're seeing become a much bigger problem than when we initially imagined, because of the fact that you have these institutions that are really on the front lines that are afraid to even put things on their website. In fact, they're being told to scrub their websites in order to get funding, which they may not even still get. The donors are afraid. The institutions are afraid. And so my concern is that that these nonprofit organizations, other institutions are hanging by a thread. But I remind folks, by the way, a relative of mine was a co-founder of Marcus Garvey's UNIA, Thomas Michael. And I always think about diaspora, right? I always think about community. I tell people we've done this before. This is a little different time, but we know how to get through this. We've taught each other, fed each other, clothed each other, ministered to each other before. And I think going back to community is going to be really helpful, and trying to strategize around really just how to get through this moment. But I do have a concern that the institutions that our communities lean on are being intentionally starved.
You know, the other aspect of institutions around health equity, you know, think of what happened after the summer of George Floyd, right? You had a lot of institutions, just say, oh my gosh, this is terrible, we got to do better, and, made all sorts of pledges and protestations about what they were going to do. And, it wasn't just, banks and insurance companies, it was healthcare institutions too, by the way, who made broad, platitudinous statements about how they were going to lean in, quote unquote, to addressing health equity. But, there's little evidence of it now. And so you don't want to be cynical, but yet you have to be, right? Because, nothing really materialized. And so the critique against institutions in the health equity space is probably too little, too timid, not deep enough, not putting enough resources on the table. And so, how do you react to that? Because I do think this is a healthcare university. We care deeply about healthcare, public health, individual health, taking care of people from the beginning of life to the end of life, and taking care of communities in terms of social epidemiology. But, again, I think you're left, with a void of an empty feeling of void, because institutions haven't really lived up to our expectations. Arva, in on that?
Yeah, when I think about that, a lot of things came to mind, and also that moment after George Floyd, because as you can imagine, being the head of a civil rights organization, I literally got phone calls, and they were just like, "Okay, so is this the Urban League?" Yes, it is. Okay, so you're Arva Rice? Yes, I am. So this is the Black Urban League. Yes, it is. Okay, so all right. So we want to figure out some partnership that we want to do with you, or we literally we want to get your ACH number because we want to send you money, right? And so we had a lot of calls like that right after George Floyd, including from a hospital and a healthcare provider. The healthcare provider is still with us. They're still partnered with us. They're still trying to figure out how to work with all of our programming, and also recognize the fact that, we had another organization who will remain unnamed who called and said, "Can you all get us some nurses? Can you all get us some Black nurses?" And I'm like, Are we going to invest in teaching young people about the nursing profession, exposing them to this possibility, and then providing with the support and the training in order to provide the child care, in order that these folks can go through? No, just send me some black nurses, right? So they wanted it to kind of magically sort of appear versus being truly invested in the process in order to make that happen, right? And so for me, when I think about the investment in institutions, it's the investment in helping the workforce to be more reflective of the individuals that look like us, but it's also the care of the individuals as well, right? And I think that it's important for us to look at from both perspectives. And as a civil rights organization, we're always going to look at it from both those perspectives. And I think that so in the case of the healthcare provider, they stuck with us. They figured out partnership ways. They figured out ways in which to start to help us to introduce young people to the idea of jobs in healthcare. And there's some other people who they didn't stay the distance. It was more talk. It was more empty promises. And the importance of this, as we all know, is the aging generation that we're in right now, where a lot of us are taking care of kids, but also taking care of parents as well. And when I think about why it's so important for us to have a workforce that looks like us, I was just at a conversation recently, found out that a gentleman that I know for a really long time was HIV positive, and I didn't know that. And so he was talking about it, and he said that he was trying to figure out a doctor that would be best for him. And so he was asking some of his friends, should he look for these traits or that traits or the other thing, and his friend said to him, "You need to find a doctor who wants to make sure that you stay alive." Right? And I know that in interacting with when my father had cancer, I wasn't sure that the doctor that he interacted with wanted him to be alive. But I know that the chances of somebody who looks like me, a sister, a brother who looks like me, is going to want to make sure that I get to the other side. And that's the importance of this work.
And I just wanted to add, we're doing a wonderful collaboration with Dr. Booten Foster here with the Coalition to End Racism in Clinical Algorithms. And the striking thing is we're talking to medical societies, hospitals, policymakers across the country about how they managed to get race out of the algorithm that calculated, creatinine and EGFR in chronic kidney disease. And the thing that really comes across when you talk to them is that this medical society says, well, we saw that these people were doing it over there, so we thought we had to do it. And these people thought these people over here. But what's happening now is the opposite, where, we see, all the people that tried to stand up capitulating. And so it's having the opposite effect. And what you really see is that when you look at what happened with EGFR was everybody that we talked to comes back, sadly, to the death of George Floyd. Like, that was a catalyst for so much. Is it going to take a death again? And clearly, when we see the deaths now of the two white people who have been killed so, openly on TV, now the streets are filled in Minnesota. I mean, what does that tell us about us as human beings, that it takes this extreme situation to really change things?
So, my Downstate colleagues start formulating questions. We're going to open it up for questions for this terrific panel. But you're right. This is a very fraught time, and Basil, that we've survived some bad presidents of the United States. Woodrow Wilson was a horrible president. That's why at Princeton, anybody from Princeton graduate in here? That's why they took down the name off of the Woodrow Wilson School of Public Affairs, because Wilson was a horrible racist. And when he became president, he took out the whole layer of black civil servants throughout the federal government overnight. So we've survived bad presidents. I have my two favorite presidents. Number two is Barack Obama. Now you say, well, who the hell's number one? LBJ. Lyndon Baines Johnson does not get enough credit for what he did for this country in terms of the civil rights legislation. He pushed it through. His unyielding commitment dealing with the white Southern bloc in the United States Senate, housing bill, I mean, the Great Society programs, Medicare and Medicaid were signed by President Johnson at the Truman Library in the presence of Harry Truman, who had tried, when he was president, to try to get a national insurance program. So if you look at what LBJ did, underappreciated president because he just got bogged down by the Vietnam War, it was true presidential commitment to changing the country across the board. And like I said, we owe a tremendous debt of gratitude to President Barack Hussein Obama for getting the Affordable Care Act. Because we can run around and talk about, health equity and health disparities all you want. But I've always maintained as a physician, the first thing you do to address health disparities is put an insurance card in somebody's hand so they can go to the doctor. They can get their blood drawn. They can get their x-rays. And whether that insurance card is a Medicaid card, Essential Plan card, Health Exchange card, that we see the data. Marlene, you've seen the data in terms of earlier detection of breast cancer in Black and Latino women because of Medicaid expansion. And so, the assault, the most, thing I get really worked up on is the assault on Medicaid. Because Medicaid is a tremendous benefit to communities, both white, Black, brown, and whatever, to get health care. And if you listen to President Johnson, you can go to the LBJ Library in Austin, Texas. It's fascinating, and they have all these tapes where the president's on the phone with his advisors trying to strategize about how to get Medicare and Medicaid over. And the president was just insistent, no, I want this done. And they'll say, Mr. President, I want this done. And he, LBJ liked to curse, so he's very colorful. But you get that this man was on fire in terms of getting, stuff, getting help to Appalachia, to, south side of Chicago, the Bronx in terms of health care and food stamps and all. So, look, you guys got to go back and look what President Johnson did in terms of social policy in this country. We survived Woodrow Wilson, who was horrible. And so you gotta hang in there, and we gotta keep chugging forward. So the way forward.
Yeah. Well, I said part of it earlier, which is that we have a history of teaching each other, ministering each other, clothing each other, feeding each other. We have school lunches because the Black Panthers did breakfast and lunch. So we have always set a standard. It's co-opted by other folks, but we've always set the standard. And I think we need to continue to do that. After the election, a lot of us were like, yeah, I'm kind of done for a while. Understandably so. We're tired. It was a hard year. Take your rest, get back up, keep going, plain and simple. Right. But I want to use your point about LBJ to make the larger point, because one of the things that I say about LBJ is that he doesn't get the credit for righting the wrongs of the New Deal. Let me explain that. Arva and I, we've known each other, I think, 4 jobs ago in each of our lives, and we're kind of a roadshow. We have a roadshow. So I happen to be on a trustee of the FDR Presidential Library and Museum. If you haven't been up to Hyde Park, you should go. It's a wonderful place. They had a civil rights exhibit a couple of years ago, which I was had a little bit to do with, and we did a sort of a panel discussion to kick it off. And I invited Arva to be a part of that discussion, and we were talking about the civil rights legacy of FDR. Now, what's interesting as you talk about sort of as Black folks, our involvement in the federal government and in policymaking, the other panelist was a friend of mine named Jill Watts, who wrote this great book called The Black Cabinet that talked about the number of African Americans, including Mary McLeod Bethune, Eugene Kinkle Jones, which a couple of us know, and everyone else. One of the jewels of our beloved fraternity, Alpha Phi Alpha Fraternity Incorporated. That's exactly right. We'll talk about that later.
And also a National Urban League president.
National Urban League president. And Du Bois and others who were very involved in pushing the federal government to be more responsive to the African American community. That became that became really important as FDR was fighting against Southern Democrats, because the Democrats were segregationists at that time, maybe still, I don't know, but it was so
the Republicans
of that time. And they were chairing all of these really important committees. And those Democrats said that, long story short, those Democrats said they would push through the New Deal programs as long as they didn't benefit black people. So took us out of opportunities for Social Security, all the GI Bill, all of the benefits that went to white veterans were not going to black veterans. The creation of suburbs as we know it occurred during that time, but then of course, redlining, so on and so forth, kept us out of that. So a lot of the wealth disparity that we experience now started right then and there. And cemented, right. Cemented from at the highest levels of government right then and there. So what LBJ did was say, I'm going to right those wrongs, and recognizing that he would also have problems getting it through the House and the Senate, said, well, instead of targeting race, we'll target people who would be in other ways underrepresented or disadvantaged, and certainly people who are poor. So this was the war on poverty. So you had
and
all...
The Kennedy administration was too timid.
Too timid. And so everything, a lot of what we engage now in terms of those federal programs, a lot of the access that we have now came through LBJ's intentionality about righting those wrongs, including Title IX of the Civil Rights Act, which opened the door for more women to go into professional schools and get professional degrees, right? All of which is being taken away right now, by the way. So having said that, keep the pressure on, because that's what's working. That's right. And you know, one of my intellectual heroes, Derek Bell, Professor Bell, talked about this concept called interest convergence. That one of the things that's real that we see, right, is that you have black folks pushing, moving the needle, Latino communities also doing that, young lords as well, East Harlem and beyond, moving the needle. But oftentimes, when we have the convergence of our interests and white interests, we start to see the needle move. So yes, there were some deaths at the hands of ICE, but it's these two white deaths that have actually gotten the president to the extent that he has to back down, right? Now, do I think that that's problematic? Yes, because that dehumanizes us and puts a more human face on them. But that interest convergence is something that's occurred all throughout history. And that's the thing that we have to also be strategic about.
That's right. Interest convergence is a good thing in terms of various population groups coming together and leaning in to societal progress. Arlen, you want in on this?
I think Basil said everything.
He said it. Okay, well, let's open it up.
So let's ask
Let's open it up.
Let's hear it.
Let's open it up to my colleagues.
Actually, we have one question in the chat, if I can find it.
Okay.
I had it, sorry.
Okay. But while you're looking for that, question in the back. Now, panelists, I have some great students back there.
Oh, student.
Where's my students? Raise your hand. Students? Any students back there? No students? These are all my colleagues and faculty? No. Okay.
I would like to ask a question about students, since we're starting with students.
Please, Professor.
As the Dean of Students, I'm going to center students every chance I get in the
Yes.
School of Public Health. So we talked about weaponization of government. We talked about the importance of political determinants of health. And yet we know that we don't do a good enough job as institutions teaching our future healthcare professionals about these political determinants, about how to really advocate for change, and whether it be community organizing or advocacy work, because so often we see ourselves, as we said, as medicine and science and public health is not being political, but I like the political, not partisan. And so your reflections on and where we need to be doing more specifically to be really, empowering our future healthcare professionals to really understand that community organizing and learning about political advocacy and being present and involved in your local communities is a form of health and healthcare.
Yeah, let me take a crack at it, because from a medical educator point of view, we physicians, meaning those of us who've gone through the pre-med gauntlet and then into medical school, politics was kind of like frowned upon. You right, Chuck? Where are you? Right, politics was frowned upon for medical students to get involved in politics. Right, and so there was a strong disincentive for medical students to pay attention to anything political because it was not science, it was not medicine. It's distracting from your on the road to become a physician, right, Chuck? But I can tell you that modern day medical students, they're not like that anymore. Thank God. They brush that aside. They want to be involved in the issues of the day. So I think from a generational point of view, I'm very elated that our medical students lean into participating in the free clinic, the advocacy work around whatever it is, student loans or access or SNAP benefits. So I think the modern day medical student is much more attuned to understanding how politics plays a heavy role in healthcare. And I don't know if I've misread that, Dean, but I think medical students in 2026 are way more advanced than when we were in medical school in terms of understanding how politics and political issues may impact their ability to take care of their patients and their communities. So, yeah.
I mean, I think,
Especially our students.
Yeah, yeah.
They come to Downstate to take care of our people.
Right, that's right.
and even beyond the politics, the political, I think, is a story, is a narrative, because it's all about words right now. And so many people who are not well, who are sick, don't even understand really what's going on with them. And what we're seeing is that as science, AI, like all this stuff is taking off, many people are being left behind. And we're so busy trying to keep up with notes and Epic. I don't know if we have Epic here, but like there's so many other competing interests
We have
that
something way older than Epic.
that people are, so many people are being left behind and finding, I don't know how you find the space to listen and to explain in simple ways, but I think partnering with physicians, scientists who understand narrative, and so can partner with the artists and the storytellers to help out. I think that's how we're going to keep our patients and our communities healthy.
Just a quick addition to that, with the question specifically about the students, is really to encourage them to come to the community, right? And so to see and feel the intersection at work. I would be remiss if I did not mention the National Urban League publishes something every year called the State of Black America, and it's something that was created when Vernon Jordan was the CEO at this point almost over 50 years ago, and it really looked at a couple of different key areas, and one of which was health. And so at that time, when they were talking about the disparities in health, it was unknown at the time. Nobody had ever studied it. And so I think that it's important for individual young people to be able to find the places and spaces other than in a hospital where they can talk about health and talk about the ways in which they can have an impact both in policies and other places.
Right. Her boss called me a few years ago, maybe 6 years ago, Arva. He said, would you write a piece about blacks and genetics? So I can't remember what year I submitted to that report, but the thesis of the report was, look, all Americans should have access to the present and coming genetic therapies that can improve and prolong life, and how because of some historical sort of issues we've been through, because even during the COVID era, remember when I did those calls, and there was a little bit of reluctance in some pockets of the black community around the country to get the earliest vaccine because they raised issues about Tuskegee, right? And so I really had to break down the difference between what happened at Tuskegee and what's going to happen here. Many people forget that Tuskegee, the United States government did not give those men syphilis. They just never told them that they had syphilis, right? So but there was a great mythology out there that the United States government, i.e. through the federal, the Public Health Service, gave men syphilis. No, that's not true. They just didn't tell them that they had syphilis. And the second cardinal sin is that once antibiotics came online, they didn't give it to them. The third issue, I said, look, our history is complicated. Why did the Tuskegee syphilis experiment happen at Tuskegee? Because Tuskegee Institute lobbied to get the experiment put there. People don't realize that. You go back and read the history. The superintendent of Tuskegee University, that's what the presidents were called, Moten, actively lobbied the Public Health Service. No, put a study down here. We need research dollars at Tuskegee. And so when you look at that, you say, oh my gosh, but so our history is complicated. So we had to disentangle all that to say, look, this COVID vaccine will do three things. Remember, I used to break it down this way, Arva. It'll keep you out the hospital. If you do get in the hospital, it'll keep you out the ICU. Mm-hmm. And the third thing, it'll keep you out the funeral home. Oh, yeah. I had to break it down like that, right? And so then people started getting it, right? So, okay, hey, but you have to, meet people where they are in understanding and sometimes disentangle, what they've heard.
I'll just say, if I could just say very quickly, because as you were talking about, I'll make a point in two plugs. Whereas you were talking about COVID, I can't help but elevate the memories of the family and friends that any of you have lost. But I lost 19 people during COVID. And a lot of it was just fear of the institutions that were talking about the vaccine, and all of this sort of cultural, historic sort of conversations that folks were having about injecting something in you, putting something in your body. So that's why social networks are incredibly important. Mm-hmm. Being in community, talking to trusted people, whether whether it's about voting or it's about healthcare or any other big policy issue, your social networks is sort of the strongest chain of individuals that we in the business of this try to break into, because we know how influential they can be in your lives. Right. Incredibly important. The two quick plugs I'll make. I teach in the School of Professional Studies at Columbia. We have a narrative medicine program, so just take a look at that, a master's program in narrative medicine. And then the second point is, as we talk about this, I have to make a plug to really think about young Black men. Mm-hmm. The feelings of isolation that a lot of Black men are experiencing in community right now is extraordinary and has, I don't want to say been overlooked, but I think underappreciated. And the decisions that they're making because of that sense of isolation are quite startling right now. So that's just my quick plug.
No, and the whole issue of men in our society is huge. Scott Galloway at NYU has written this book about, and Professor Galloway is always on many of the shows that Basil's on, but his thesis is that men in general are so isolated, and it's worse isolation with Black and brown men. But yeah, that's a key dimension.
One quick plug to pay attention. Going back to, you mentioned genetics. Mm-hmm. I think the eugenics has not gone very far. Nope. And there's so much information, and people interpret data incomplete. Like, you can take this. When I was at the Boston Public Health Commission, we did one of the definitive studies on masking using publicly available data. And I can't tell you how many people took the same data, got the same results that we did, and interpreted that masking was bad. Right. And so if you think that's just simple data, imagine what they're going to do with all the genetic data. And there's a great article in this last Sunday's Times on that. I think it's really, I'm giving a plug to read it.
Dr. Nayez-Osaze.
Yeah.
Thank you so much to the entire panel. This is a thought-provoking conversation. I'm glad we're having it. The one thing I wanted to mention is that we have the conversations I've been having with my colleagues, friends, community members, is just the overwhelming feeling that this government is just tearing everything apart to the point where they feel helpless. They don't believe that these policies can be reversed again, that whatever decisions have been made by executive order or by the people who have been replaced, that we're in a position where nothing will change. And I want to know if you could just talk a little bit about what are the chances of being able to, after this administration is hopefully done and gone, to be able to revive the policies that do serve our people. And what do we tell community members who have checked out, who don't believe that anything can change and that we've lost all hope.
Yeah. But look, this can be reversed partially, but it's going to take a decade to reverse these 4 years. And so, look, the first step, and I will be political here, is in November, we got to have one house of the Congress change,
Right.
because that will be a break on further craziness for the last 2 years. And then you got the presidential election after that. So lasting damage will be done. Can it be repaired? Yes, but it will take a while. That's my view. I'll see what my colleagues think.
I mean, I think we're watching the weaponization of uncertainty, the commercialization of confusion, and the industrialization of doubt.
Yeah, say that again.
Yeah, but
Go back to the
it's on
recording.
tape, sadly. But
That was a good one.
I do believe, though, that the way forward is together, because the methodology is about the separation. And to me, the way forward is together, and it is the story. It is the old stuff that made us human. We have to go back to that and stick to that. It is going to be different when this is all over. There's no question that we're not gonna. I think the Canadian leader spoke of this very recently. That there's a new world order coming, and to the point where I don't know what's going to be happening in Canada, but it sounds kind of good. But I think we will be different after this, and I think if we're together and we can find the heart in this, I think maybe we'll survive.
Dr. Hall, you're going to hear that on MS Now.
I will absolutely credit you. I always do that. I always credit folks. In this room, I do agree that the midterms will change things, and I will say that in a room like this. But when I go out in a community, my point is midterms will not save us. That we will. No one's coming to save us. And one of the things that I think has been what's the word I'm looking for? Encouraging about this moment is that on occasion, particularly what we're seeing in Minneapolis, in Minnesota, especially even after this tragedy, is that people are out in the street. So this feeling of this notion that we have agency, I think, was taken away from us, and I think we're starting to see ourselves build it back, and that is critically important because, and going back to the point of the midterms, presidential races are very sexy. Congressional races are very sexy, but most of the policies that impact your day-to-day lives are state policy and local policy, where we see the lowest voter turnout. And it's important to note that during Obama's presidency, Democrats lost 1,000 state legislative seats across the country. 1,000. Flipped legislatures. Why does that matter? It matters because what's happening at the federal government, they're taking federal authority and oversight out of everything so that it shifts power back to the states, because they keep talking about states' rights, right? They know that they can shift the power back to the state because there's a state legislature that sees things the way they do. This is not recent. They've been planning this for decades. By the way, Project 2025 told you so.
Yep.
Yeah.
Right?
Sure
When
did.
people tell you who they are,
Believe them.
right. So state level policy is incredibly important to really engage and making people feel a sense of agency again, but also honestly just being in community and paying attention. And I know you'll pick up on it.
It's so funny because sometimes when I'm listening to Basil, I forget that I'm supposed to speak that next. I'm like, right. It's kind of mesmerizing. But but definitely I recently had an opportunity to sit down with Senator Gillibrand, and I said to her, I spend so much time defending you and Senator Schumer. And that's not in my job description, right? But I do, and I'm trying to figure out and defend these Democrats and say that there will be a change, because as we all know, the opposite of love isn't hate, right?
Right.
It's apathy, right? It's indifference, and so that is what I'm constantly battling, is trying to make sure that people know that exactly that sense of agency, that they can be involved and engaged. And so the work of the midterms doesn't start in October for November, right? The work is starting now. And so the outreach that we plan on doing at the Urban League is making sure that when it's time for us to, start taking those buses, whether they're going to Long Island or they're going to Pennsylvania, that the buses are full and overflowing. One of the things that, I was so excited about Kamala, y'all. I just knew that we were about to have a Black girl president. And I woke up that morning and I was just convinced of it. And so we gathered all of our buses and started to go down to Pennsylvania, where we were doing some of our organizing. And one of my board members, Reverend DeGraff, he said that he knew from that morning that we had a problem because, first of all, we only had 2 buses. And he thought in his mind, he said we should have had 5, right? And he said and I said to him that some of the organizations that we had reached out to that we wanted to be involved didn't know if they would be back in time for the after party. Or they didn't know. Girl, exactly, right? They were reviewing a viewing, right? And all these other things that they had going on. And so for Rev, who had been in this for so long, who had been part of the moment, he was just like, I'm not feeling the same feeling that I had the morning that I woke up with for Obama. And so my commitment to this work is to continue to work with those folks who are, I'm not sure, is it going to be a difference? Is it going to make a change? I'm going to keep pushing, Senator Schumer and Senator Gillibrand and Congressman Espaillat to make sure that whatever it is that they're doing, can you get it a little bit closer to us so that we can know about it, right? Can we know what it is that you're working on, what your strategy, what your plans are, so that we can convey it to everyday folks and we can move from that state of indifference to actually being and staying engaged, because we've got to do it.
All right, 2 more minutes. No, we got to end on time because these wonderful people have a lot of other obligations. So, any other questions there?
Yeah, there's a few questions here
Okay.
in the chat, and
Okay.
there's a question here. So, this question is from Sharon Walker. How should healthcare institutions redefine power so that communities most impacted by inequities are not merely consulted, but meaningfully involved in shaping solutions? So moving from individual agency to institutional accountability, and what does that mean for us to redefine power as healthcare institutions to really achieve that?
Dr. Hall?
We are the sum of the people who are in these institutions, right? So, and going back to Circa, when you look at the success of that project, it was because there was a Black physician in the mix in almost every one of those organizations. So I think the thing is that we need to train the next generation or the current generation of everyone and make sure that they land in the right place, that we use our networks, we sponsor them, we get them where they need to go, but we've trained them and they have the heart and the minds and the intention to do the right thing.
I'll say this very briefly. You talked about generationally how some of the students think differently about politics. One of the things that I'm trying to infuse in a lot of my programs is is advocacy. So like we're teaching that because it is important to understand like who you need to talk to, what you say when you talk to them, how to build coalition. And one of the things that frustrates me to no end is, when folks want to fight and they want to rally and they want to get in the room and they're in the room and they don't know what to ask for. That is a hard truth that you have to acknowledge, right? It's not enough to just say no. You have to know what you want, and we're actually being intentional about teaching that.
We got to teach that. Yeah. I think one more. Go ahead.
There was one more question about what does moral courage look like for healthcare leaders today?
I'll just answer it with one word. It looks like this.
Well said. All right. Thank you, everyone. I think if anybody has any additional questions, certainly be back to entertain any.
Well,
other.
let me thank all of you for coming, and all of you have been tremendously engaged, and we do this for the benefit of our community to provide thought-provoking conversations. and sometimes uncomfortable conversations, but that's the beginning of growth. And that's one thing I love about this place. We're fearless in terms of doing that. So kudos to all of you for being here. I know you have many other things to do, but it's always good every year, every January, to stop and to do something to honor the memory of the late, great Dr. Martin Luther King Jr., who made a difference in this world. Thank you very much to our panelists.
Thank you.